My name's Nick Dolmeyer, and my final project is how malaria spread during the colonization of the Americas. Who, where, and what happened? Who? European colonizers coming over from Europe, enslaved Africans coming over from Africa during the slave trade, and Native Americans already living in the Americas. Where? Europe to the Americas and Africa to the Americas. What happened? During the European colonization of the Americas, both Europeans and enslaved Africans contributed to the spread. Malaria spread through blood and mostly through mosquito and bug bites. It was later exacerbated by the transatlantic slave trade. Historical and geographical context about malaria. Malaria is an ancient disease caused by Plasmodium parasites, transmitted by nail or marsh mosquitoes. It originated in Africa and spread to parts of Asia and Europe well before European global expansion. Malaria was introduced to the Americas during and after the transatlantic slave trade. European colonizers brought African slaves who often had partial immunity to the disease. Malaria, along with other diseases, devastated indigenous people who had no immunity. The epidemiologic factor facilitated European conquest and colonization. Medical anatomy of malaria. Once the parasites from the mosquitoes are inside your body, they will travel to the liver, where they mature. After several days, the mature parasites enter the bloodstream and begin to infect red blood cells. Within 48 to 72 hours, the parasites inside the red blood cells multiply, causing the infected cells to burst open, causing the spread of the infection throughout your bloodstream. Why is malaria a public health concern? It's a public health concern because it causes millions of infections and hundreds of thousands of deaths annually, especially among children under 5 and pregnant women. It also spreads easily in tropical areas where mosquitoes vector thrive, making control difficult. These tropical areas also aren't the wealthiest either, so it causes limited access to health care. Lastly, the malaria parasite and mosquitoes are increasingly resistant to drugs and insecticides, complicating prevention and treatment efforts. Solutions for malaria. Vector management tools such as insecticides, environmental modifications, and bed nets have contributed greatly to the success of malaria control efforts historically, but have faced setbacks in recent years due to factors such as emergence of insecticide resistance in mosquitoes. Secondary solution. To combat the insecticide immunization for mosquitoes, the other option, which is the easier option if you're able to afford healthcare, would be either to get one of 3 vaccines provided by healthcare to combat malaria. First one, RTS-S AS01 vaccine, a seasonal malaria chemoprevention SMC for children, or perennial malaria chemoprevention PMC for adults. Why was and still is the study of malaria important? The study of malaria is crucial because it is a major global health problem, especially in tropical and subtropical regions, leading to significant illnesses and death. Understanding malaria is also vital for developing effective control measures, including new drugs, vaccines, and diagnostic tools. It also helps in understanding the parasite's biology and transmitting dynamics, which are essential for designing targeted interventions. What did scientists learn? Scientists have learned that malaria is caused by parasites transmitted by mosquitoes, that it can be effectively treated with medications like quinine, and that it can be prevented with measures like insecticide-treated beds, nets, and mosquito control. They've also discovered how malaria parasites adapt and evolve, leading to drug resistance, and have developed new vaccines and other interventions to combat the disease. A first-hand account of malaria. Christine Silver-Street was a junior in college when she took a study abroad trip to Ghana for a semester. She was there really to visit a clinic which she had helped raise funds so that some 100,000 rural Ghanaians would have the possibility of health care. But little did she know, she would visit a Ghanaian clinic much sooner than she thought, but not as an honored guest, as a very sick patient. The clinic near the university where she was sought treatment was dark and claustrophobic, filled with old and outdated medical equipment. The doctor told her that she had malaria as he handed her the edge of a piece of newspaper to stop the bleeding from the blood test she had just taken, because they had temporarily ran out of Band-Aids. He assured her that with a packet of anti-malarials, I would be fine within a week. That did not happen, and she was given substandard pills, which did nothing, as the malaria was morphing into a dangerous, drug-resistant strain inside her body day by day. The parasite attacked her brain and neurological system, leaving her upper body paralyzed partially and only being able to move her legs a few inches. She eventually got transported to a private clinic by native Ghanaians and received anti-malarial medication which targets cerebral malaria, which is the type of malaria she had. Within a week, the disease's immediate effects had subsided, but I desperately needed a long-term physical and cognitive rehabilitation, Christine stated. Days later, after getting the medication, she went back for a checkup, and the Ghanaian doctor said she was very lucky. Lucky to be an American, that is. Had she grown up battling other diseases, her body might have not had the strength to beat malaria, which is unfortunately very common for native people of Ghana and Africa as a whole. Christine states in the article, over a year and a half has still passed since I was diagnosed with malaria, and I'm still recovering. I go to PT 3 times a week to build strength, and I participate in a brain training program to improve memory and attention span. Thankfully, I'll make a full recovery in both body and mind within the next year. As an American, I could leave Ghana when my body was simply had no fight left. And now, back in the States, I have access to specialized care to aid my recovery. That's something rarely available in Ghana. Christine has now almost made a full recovery from malaria since the article came out. And here my works cited, and thank you for listening.